Hey everybody, my name is Dr. Scott Giacomucci, and I'm the author of Trauma-Informed Principles in Group Therapy, Psychodrama, and Organizations, Action Methods for Leadership. And in this video, I want to take some time to talk to you and share with you a bit about some of the content from Chapter 10 of this book. Chapter 10 is focused on the sixth trauma-informed principle from SAMHSA. The title of the chapter is Cultural, Historical, and Gender Issues in Group Therapy, Psychodrama, and Leadership. So this is focused on SAMHSA's sixth trauma-informed principle, which is about culture, history, and gender, and really all issues related to identity. So in this video, we're going to be talking about identity and how it plays a role and impacts us and everybody else in the context of group therapy, in psychodrama practice, and in organizations. While this video is going to specifically focus on the sixth trauma-informed principle, it's also important to note that all six of the trauma-informed principles really go hand in hand. We can't just focus on this sixth principle without also considering the other five principles. So if you're not familiar with those other five principles, I encourage you to check out the other videos on this YouTube channel and the other chapters of the book where I go into detail about all six of SAMHSA's trauma-informed principles. What I noticed in my research is that this sixth principle about identity does not seem to be included in the early definitions of trauma-informed care and in the early lists of trauma-informed principles. If you go on Google and search for trauma-informed principles, you'll still find older lists that only include the first five principles and did not include this sixth principle, which I think is really disheartening and just unfortunate. We really, really can't embody trauma-informed care philosophy, the 4 R's of trauma-informed care, especially resisting re-traumatization. And we really can't embody the 5 other trauma-informed principles, safety and trust and peer support and empowerment and voice and collaboration, if we're not also addressing issues related to identity. So I really believe that this sixth trauma-informed principle is essential and really required, and it's often the one that gets most overlooked and often the one that most individuals and organizations, I'll put myself in that category too, have the most room to grow in. So when we think about trauma, we have to keep in mind that trauma is always going to be contextualized within an individual's identity. That the gender, the age, the race, the ethnicity, the cultural belief systems, the religion, citizenship, all these different aspects of identity are going to play a role in how an individual experiences the world and how an individual experiences adversity. So we can't fully understand anybody's experience of trauma if we're not also considering their experience, their identity, and how it impacts their experience. SAMHSA states that culture is the lens through which reality is interpreted. Without an understanding of culture, it's difficult to gauge how individuals organize, interpret, and resolve their traumas. So this is a quote directly from SAMHSA's publications on trauma-informed care. And we have to keep in mind that many people's experience of trauma are going to be directly related to or because of their identity. This is especially true when it comes to any kind of collective trauma, identity-based trauma, discrimination, gender violence, oppression. These are all real traumas, and they're traumas experienced specifically because of some aspect of somebody's identity. So things like discrimination, racism, racial trauma, these are all strongly related and correlated with PTSD diagnosis. So it's important that we're expanding our definition of trauma to include these types of collective traumas. And in many ways, I like to think of racism, discrimination, oppression as more closely related to complex trauma than being related to a single incident trauma, in that they're often happening again and again and again and again, reenactments of it, microaggressions, new harms through society, through relationships, through communities, through organizations. And there's just layers and layers and layers of additional harm caused. So, when we're talking about collective trauma, what we're talking about is when an entire group of people experiences traumatization. And this is often based on either violence directed to that entire group based on their group identity or discrimination, or sometimes we could think of collective trauma as being related to geographical proximity. For example, if there's a natural disaster and an entire group of people in the same geographical proximity are impacted, they're experiencing a shared experience because of their physical location. Whereas most types of collective trauma are more related to shared experience based on social location. So lots of different types of collective trauma. Collective trauma could include things like natural disasters, earthquakes, war, community violence, terrorism, genocide, poverty, famine, pandemics like the COVID-19 pandemic, and any other form of systemic oppression or discrimination. The symptoms of collective trauma are going to manifest in our collective bodies. This comes from some ideas and theories from Thomas Hubble in the book Collective Trauma. So the symptoms of individual trauma show up within our individual bodies and psyches. The symptoms of collective trauma are going to show up within our collective bodies and collective psyches, within our groups, within our communities, within our organizations, and within all of society. So in that same book, Hubble and Everett explain that collective traumas distort social narratives. They rupture national identities and hinder the development of institutions, communities, and cultures, just as personally experienced trauma has the power to disrupt the psychological development of a growing child. I think this is a pretty powerful idea and really illustrates the widespread impact of collective trauma. That many times we think about just the individual's experience and long term effects of a collective trauma, but we also have to consider the collective impacts and the macro impacts of collective trauma. And the research and writing and prevalence of discussions about collective trauma and about ancestral trauma really continues to grow in the field. Oppression and discrimination based on one's identity can manifest in a variety of adverse conditions. It can show up as classical post traumatic stress symptoms. It can emerge as emotional distress, hyperarousal, alienation, isolation, anxiety, being worried about the future, having a fear of other people, difficulty coping with emotions, a loss of safety in the world, negative beliefs about ourselves, others, or the world, avoidance behaviors, disturbing images, flashbacks, nightmares of re experiencing, dissociation and numbing behaviors, depression, anger, rage, low self esteem, shame, and other forms of post traumatic stress. So, like I said, the pervasive and ongoing nature of identity based trauma, discrimination, and oppression is quite similar to the impacts of complex trauma. And I think thinking about it through the lens of complex trauma can be really helpful and give us a basis of understanding, a basis of how to talk about it, and basis for treating and cultivating healing. So, this sixth trauma informed principle about gender, culture, and history, although they state it as just being about gender, culture, and history, it's really larger than that, and it has to do with all aspects of identity. There's a framework for identity that I found really helpful for myself in my own learning, in my own practice, and my own teaching, which is the addressing model by Pamela Hayes. So, the addressing model outlines a multidimensional theory or conceptualization of identity and of intersectionality. So, it's called the addressing model because the word addressing becomes an acronym for the different layers of identity. The A corresponds to age and generational influences. The two D's are combined together in the acronym to represent developmental and acquired disabilities. The R in addressing has to do with religion and spiritual orientation. The E is about ethnicity and racial identity. The first S represents social class, culture, and structures. The second S is about sexual orientation. The I in addressing is about indigenous heritage or lack of. The N has to do with nationality and national origin. And the G is about gender. So the addressing model provides us with a framework for understanding layers of identity and intersectionality. So awareness and acknowledgement of identity is the first step. So we have to be aware of our own identities, our own gender, our own age, our own privilege and marginalization. But awareness and acknowledgement alone is simply not enough. It has to be followed with action and responsiveness. Otherwise, just acknowledging it can just be performative and doesn't relate to any real change. So, I want to challenge you for a moment to reflect on these different categories in Pamela Hayes' addressing model and to consider in which of these layers of identity do you hold privileged positions in? And in which of these layers of identity do you hold marginalized positions in? And how might your identities intersect with the identities of the clients that you're working with? How often are you working with clients who have marginalized or privileged positions within these different layers of identity? So there's another framework called healing-centered engagement that was created by Sean Ginswright, which seems to really build off of trauma-informed care philosophy while also adding an additional emphasis on the importance of culture and identity, on strength-based approaches, and on conceptualizing trauma as a collective and systemic experience rather than just an individual wound. So I really encourage you to check out Sean Ginswright's publications and videos as he really obviously is going to articulate his theory better than I could. Some of the basics of healing-centered engagement are that he suggests that trauma-informed is a deficit-oriented term in that it's focusing on the trauma by the nature of calling it trauma-informed. And instead, he proposes the term healing-centered engagement as a strength-based way of renegotiating even the name that we're giving to our philosophy, which I really like, to be honest. It's really in alignment with the way that I think about trauma healing and the emphasis on post-traumatic growth in my teaching and in my clinical work, and even the namesake of my organization being the Phoenix Center, which is focused on the growth after the trauma, the rising from the ashes, rather than just focusing on the trauma itself. So I really like how Sean is challenging us to think about the work and to name the work through a strengths-based perspective, healing-centered engagement as opposed to trauma-informed practice. Sean goes further and suggests that the environment is often the root cause of trauma, and that trauma-informed care is far too medicalized and too individualized, focusing on individual treatment without offering guidance for addressing the causes of trauma within neighborhoods, families, schools, and larger society. And I think this is really true. The way that trauma-informed care has been absorbed within the field, within our highly medicalized and individualized treatment plans and industries, I think there's really there's some truth in this. I would argue that the actual philosophy of trauma-informed care is much less medicalized and individualized than the ways it's been integrated into practice. In healing-centered engagement, there's 4 key elements within this framework. The first is that healing-centered engagement is explicitly political rather than clinical. So there's an emphasis on politics and society rather than an emphasis on clinical. Second is that healing-centered engagement is culturally grounded and views healing as a restoration of identity. I think that's pretty powerful. Healing-centered engagement is culturally grounded, so the practices are grounded and rooted within the culture of the community that's being worked with and engaged with. And healing is being viewed and defined as a restoration of identity. So that would suggest that the trauma is causing a disconnection or a rupture in one's connection to their identity. And I think this is particularly true with collective trauma. The third key element is that healing-centered engagement is asset-driven and focuses on well-being rather than on symptoms. So in this way, it's really a humanistic approach, a strength-based approach, kind of congruent with positive psychology and humanistic psychology. And the fourth key aspect is that healing-centered engagement supports providers in engaging in their own healing. And I really love this about healing-centered engagement. I think it's something that probably could have been emphasized more in trauma-informed care philosophy, that the healing and the well-being of the provider, the professional, the therapist, the leader, is of utmost importance. That if we haven't attended to our own well-being as professionals, we're going to be pretty limited in helping others achieve a state of well-being as well. So these are the 4 key areas of healing-centered engagement. In my experience of learning about healing-centered engagement, I feel like it really encompasses trauma-informed care, expands on trauma-informed care, and then really emphasizes this 6th trauma-informed principle of issues of identity, gender, history, and culture. It seems like healing-centered engagement is really re-emphasizing many of the components that are present in trauma-informed care philosophy that often get lost in the translation from the theory and philosophy into the actual practice. So the 6th trauma-informed principle, addressing issues related to identity, culture, gender, history, is particularly important for group therapists and group leaders. So groups have a real unique potential to promote healing from discrimination, from oppression, and from collective trauma. That's simply going to be impossible to access in the same way through individual therapy or one-on-one work. Group work is going to offer exponentially more opportunities and potentialities for corrective emotional experiences related to discrimination. And this really becomes concretized in the group, felt in the group, through a sense of group solidarity, a group acceptance, and a sense of belongingness within the therapy group. In the history of group therapy, group work really emerged through social reform. It was influenced by democratic principles and social action, social responsibility and advocacy, social justice, and empowerment for oppressed communities. And this is particularly true in the social work with groups tradition, when we trace our history back. However, many of the most popular contemporary group therapy approaches really fail to adequately address issues of culture, diversity, and oppression. So, considering our biases, considering diversity and oppression and social justice is not just a clinical issue, but really an ethical issue for group therapists to consider. Without cultural humility and an anti oppressive stance as group workers, we're really prone to inadvertently falling into traumatic reenactments or re traumatizing individuals in our group related to issues of identity, oppression, and marginalization. So, cultural competence really is a poor way, a flawed way of looking at it. We're never going to be competent in a specific culture that isn't our own. Instead, a better framework that's been proposed is looking at it through the lens of cultural humility, which recognizes that we're not the expert in other cultures and that we need to approach the work in the spirit of humility. However, many have suggested that cultural humility is also flawed in that it's a passive approach to the work, and that instead we should strive to embody cultural responsiveness. So, cultural responsiveness means that we approach the work through the lens of cultural humility, but that rather than just taking a passive stance, we're responsive and we take action around issues of identity and culture. So, there's some recommendations that were offered by Burns and Ross in a 2010 publication. Recommendations for incorporating anti-oppressive methods into group work and group facilitation. Some of the things that they recommended were that in our intake questions, we also include prompts and questions to participants when we're pre-screening for participation in group about their ability and willingness to have discussions about identity and about oppression. They also recommended that we consider diversity and intersectionality in the developmental phases of the group and the development of the group as a whole. The third recommendation they offered was that we use structured activities that center around issues of privilege and oppression within the group. That we're not just aware of it and asking about it in intake, but that we're also interfacing with it within the group. And the fourth recommendation they offered was that we are processing here and now issues related to oppression in the group here and now as they emerge, that we're taking the time to address those and try to work through them in the group experience. In my own work, I found that it becomes really important to also include some group norms and some group rules that name issues of identity and ask participants to commit to respecting each other's different identities, belief systems, religions, gender, sexuality, race. So, in all of my therapy groups and training sessions, whenever I go over group rules, I include a group rule about mutual respect based on identity. And I find this to be helpful because it sets the tone early on that right from the start, in talking about confidentiality and safety, we're also mentioning identity. And it's opening up setting the tone really, and ensuring that the facilitator is the first person to mention issues of identity and opening the door for those issues to be explored throughout the group process and brought up by other group members. So, oftentimes in our group facilitation, we might, or other people in the group might, experience microaggressions during a group therapy session. And so we have to consider how we're going to respond to microaggressions in real time. We can't just ignore them. Then somebody or part of the group is going to feel ostracized, is going to feel hurt, is going to feel shamed, is going to be angry, is going to feel rejected. Though many times when I've seen people address microaggressions, they do it in a way that is incredibly shaming and leaves other people or another person in the group feeling isolated, ostracized, and shamed or rejected. So I think there's a middle ground somewhere in that the way that we respond to microaggressions can be informed by the spirit of trauma informed care and these trauma informed care principles. So, how do we respond to a microaggression while promoting a sense of safety for the person we're responding to, but also preserving the safety of the rest of the group? By embodying the spirit of transparency, trying to recultivate a sense of trust in the group after a rupture is caused by the microaggression. By leveraging peer support in the aftermath of a microaggression or the midst of a microaggression. By addressing it in the spirit of collaboration and mutuality, holding on to a sense of respect for the person who made a mistake and engaged in a microaggression, while also challenging them to reclaim a sense of respect for the people or person that they directed a microaggression towards. How do we empower individuals in the group who are hurt by the microaggression to speak their truth about how they experienced that? And how do we empower the person who engaged in the microaggression to take accountability for their action, their behavior? So I think these trauma-informed care principles can really help guide us in our responses to microaggressions. So often I've seen facilitators respond to an individual who engages in a microaggression by reciprocating and matching, or even outdoing their anger, shame, or rejection, and projecting that all right back onto the individual, which really is not helpful, I think. In many ways, the person who's engaging in a microaggression might not realize what they've just said is harmful to others. And many people engaging in microaggressions are really engaging in the psychological defense mechanism of projection, that they're projecting something out onto another group. There's a great book by a former Gestalt therapy trainer and social work professor at Bryn Mawr College. The book is called Encountering Bigotry, Embracing Projecting People in Everyday Life. And it's exploring exactly this. What is going on psychologically and on a social emotional level when somebody's engaging in a microaggression or saying something insensitive, saying something racist, saying something homophobic? What exactly is going on for them emotionally? And the authors of the book suggest that when somebody's making a racist joke or engaging in a microaggression, that it seems like they're creating an in-group and an out-group, and they're positioning themselves in that in-group. And that one of the primary reasons somebody might feel compelled to create an in-group and an out-group, a separation, and position themselves in an in-group, is that they're feeling anxious, they're feeling threatened, and what they're really seeking is connection. And so, considering this as a defense, a projection, how can we as facilitators promote connection while holding somebody accountable for their microaggression and addressing the harm that it causes within the group? So I don't have all the answers on that one. I've had my own experiences as a group leader of missing microaggressions and not addressing it in real time and having to come back to it. I've had my own experiences as a group leader of feeling like something just happened in the group that didn't feel right, that was a microaggression, but feeling paralyzed and not knowing how to respond to it in the moment and missing the opportunity. And I've had experiences as a leader catching a microaggression, but responding in a way that just fueled more separation and more disconnection and more shame. And then I've had a couple instances where I think I've responded in really good ways that provided an opportunity for accountability and repair in the group, preserved the safety and protected individuals in the group that were being harmed by the behavior, while also fueling repair from the rupture that was created. So I think this is something that each of us as facilitators is going to have to practice, is going to have to explore based on our own identity. The way I respond as a white, straight, cis guy leading a group, the way I respond to a microaggression is probably going to be different than somebody else with different identities. My own personality and style might be different than other people's personality and styles. So you're going to have to find your own way of how you're responding in these situations. So I really want to encourage you to reflect on this for a bit. How are you explicitly incorporating and addressing issues of identity, oppression, and discrimination in your groups? Are you avoiding discussions related to identity when they emerge in the group? Or are you embracing them and addressing them, leaning into them, even when they're uncomfortable at times? Group leader that fails to consider the influence of larger social and cultural forces, aspects of identity within the group process, is failing to fully embody a trauma-informed approach. Yalom suggests that the group is a microcosm of society. Therefore, the same issues of oppression and discrimination that are present in society are going to show up within our groups. Without attending to these issues of social justice and culture, identity, our ability to cultivate the therapeutic factors within group is going to be pretty inhibited. So I encourage you to reflect on, how are your own identities impacting your perspective as a group leader and even your approaches to group work? And how might participants in your groups experience you based on your gender, based on your race, based on your age, and based on those other aspects of identity? So this sixth trauma-informed principle about culture, identity, gender, history is also particularly important in organizational settings. Trauma-informed leadership, similar to group leadership, requires a commitment to anti-oppressive practices, to cultural humility, and cultural responsiveness. Organizations oftentimes are a vessel for collective trauma either being reenacted or being healed. Again, a group is a microcosm of society. So this is also true in terms of an organization. An organization is a group. Therefore, an organization is going to be a microcosm of society as well. So the discrimination, the oppression, the racism, gender violence that exists within society, if it goes unchecked in organizations, will also emerge in covert forms of structural violence and institutional racism. So this sixth trauma-informed principle needs to be seriously considered, critically reflected on, as it relates to each of the 10 agency domains that SAMHSA outlines, which were covered in a previous video. So I encourage you to reflect on those 10 domains through the lens of identity. How are we addressing, celebrating, preserving safety as it relates to identity and in every aspect of the organization's functioning, not just the services that are provided, but everything from cross-sector collaboration, governance and leadership, marketing, recruiting, financing. How is all of this taking into account identity of the people that we're working with and identity of the people we're serving? So how does your organization consider and address issues of culture, gender, history, and identity in each of these 10 agency domains. In which of these domains does your organization seem to best address issues of culture, gender, history, and identity? And in which of these domains does your organization seem to have the most room to grow in? So, addressing issues related to identity often becomes performative, superficial, or fear based attempts by an organization to avoid being called out by others. And I think this is really problematic. It's something that I'm particularly sensitive to. It can feel really fake. Through the lens of trauma informed care, we can offer action based practices for actively addressing these issues. My colleague Leticia Nieto and some of her colleagues in a 2010 publication remind us that awareness of social justice issues alone is not enough. They say that true allyship is when awareness is combined with action. So we need awareness plus action. So SAMHSA's 2014 publication on trauma-informed care outlines 9 different steps for cultural competency and cultural humility, cultural responsiveness, which are delineated by the Center for Mental Health Services. So here's the 9 different steps. The first is that we have to recognize the importance of culture, and we have to have a respect for diversity. Second step is that we maintain a current profile of the cultural composition of the community. So this means that we have to keep tabs on and have a sense of the diversity and cultural composition of the community that we're working with, the community that we're serving. Third step is that we need to recruit workers, employees, staff members who are representative in every aspect of identity of the community that we're serving. So this means that if we're serving a primarily Spanish-speaking community, then we need to be actively recruiting and hiring Spanish speakers in the agency. If we're serving a predominantly young community, then we need to be actively hiring and recruiting young professionals who are going to be able to better relate to the young clients we're working with. If we're serving a predominantly Black community, then we need to be actively recruiting Black professionals who are going to be able to better understand and advocate and relate to the community that we're serving. So the way I understand this is that SAMHSA is suggesting that the makeup of our organization in terms of identity should be reflective of the makeup of the community that we're serving. This fourth step is that we provide ongoing training to the staff related to culture and identity. The fifth step is that we ensure services are accessible, appropriate, and equitable. Sixth step that's outlined suggests that we have to recognize the role of help-seeking behaviors, traditions, and natural support networks within the community that we're serving. That in various communities have various and differing relationships to engaging with professionals, especially medical or mental health communities. And we have to be aware of and recognize the traditions within the communities we're serving and the natural peer support networks that are already present within that community. And that we can leverage and encourage people to engage in those support networks within their own community. The seventh step is that we're involving community leaders and other organizations within the community, and we're representing diverse cultural groups as cultural brokers, that we're involving the leaders of the community in the conversations within the organization about change, about policy, about future programming, and eliciting feedback. The eighth step is that we're ensuring services and information are culturally and linguistically responsive. So if the average person in the community that we're serving can't understand or resonate with the language we're using in our groups, on our websites, in the descriptions for services, then it's not going to make sense. And the ninth step towards an organization moving towards cultural competence, cultural humility, cultural responsiveness is that we're assessing and evaluating our program, our organization's level of cultural responsiveness. So it's not enough to just implement these steps once and be done. We have to be constantly evaluating over time the level of cultural responsiveness in our programs. So again, these are the 9 steps that are endorsed by SAMHSA for organizations addressing cultural responsiveness in their programming. So this really emphasizes how we have to revisit all aspects of an organization through the lens of diversity, equity, and inclusion. Everything from the marketing, the recruiting practices, assessment, interventions we're providing, evaluations, aftercare referrals, professional development for the staff, training, and events. Every aspect of the organization has to take into account identity and culture. So I want to challenge you to reflect for a moment about your own organization. Do the identities of your agency staff at all levels of the organization reflect the identities of the clients and communities that you're serving? I really want to emphasize that everybody, regardless of their identity, regardless of their privilege or experience of marginalization, is impacted by issues of gender, sexuality, race, ethnicity, class, nationality, indigenous status, age, disability, religion, spirituality, all those aspects of identity that Pamela Hayes outlines in the addressing model. Everybody is impacted by all of them. It's not just something that folks in marginalized communities are impacted by. It's something that impacts everybody. So this 6th trauma-informed principle about identity, culture, history, and gender is also particularly important for psychodramatists. And there's lots of unique ways that psychodrama, sociometry, sociodrama can be used to address the impacts of social injustice and oppression within the work. So in this book on trauma-informed principles, there's a handful of examples in chapter 10, at the end of chapter 10, from some of the ways that I've used sociometry, psychodrama, and sociodrama within groups, within organizations, to try to address issues of identity. And I will say this is certainly an area of growth for me, and want to recognize that based on my own identities, that there's certainly going to be ways that I might be limited when it comes to addressing and thinking about and fully understanding issues related to racism and gender and sexuality and so on. So one simple use of sociometry, simple example, to explore the group dynamics related to racism is that I could use simple spectrograms. I could do a spectrogram on a scale of 0 to 10. I could start with, how comfortable do you feel talking about racism and white supremacy? And I could ask the group to self-assess themselves on this spectrogram. And this will give us a lot of important information about the group. Then I might ask a second spectrogram prompt. How prevalent do you think racism is in our society today? And again, everyone would self-assess themselves. We'd have some smaller, maybe one-on-one or smaller group discussions about the choices. And then we could move on to a third spectrogram. Perhaps how open are you to learning about racism and what you can do to combat it and address it in your life and in your work? And we'd have everyone line up again on the spectrum, assessing themselves. So these are 3 simple spectrograms that I used in a guest lecture at a social work graduate course at the University of Pennsylvania in a course on racism and social work practice. In that same guest lecture, I used sociodrama and really short, simple sociodramatic role plays where I had individuals in the group partner with somebody else in the group. So everybody had a partner, and I assigned roles to each person within the dyad and a scene related to addressing racism, advocating for justice, repairing a relationship after a microaggression, and other scenes related to racism. Had them practice those scenarios here and now in the group through role playing. This is what we would call role training, in that we're putting group members through role plays in surplus reality, putting them in situations that they're likely to find themselves in the future, and giving them an opportunity to practice how they're going to respond in that situation through role play. Obviously, you want to be sensitive and careful and thoughtful about the roles that you're assigning and the nature of the situations that you're putting people in the role plays, and ensuring that it's done in a safe and thoughtful way. Another example comes from a sociodrama workshop training that I led many years ago. This was in the United States, and some of the political social context was that it was the height of the Me Too movement. And in this sociodrama workshop, of course, I taught about sociodrama, and then it was time to demonstrate sociodrama. And I asked the group for a theme, a topic that was on their minds that we could use for the demonstration. And the participants in the group were primarily women, therapists and students, and they chose the topic of sexism and gender violence, rape culture, and sexual harassment. So this was the theme that we worked with. And as a male therapist, a male trainer leading this workshop, primarily of women, it was really important for me to acknowledge my identity in that moment and to really empower the group to lead and collaborate and co-lead the sociodrama, as there were sure to be things that I might not understand fully or things I might miss because of my gender related to the topic. And the sociodrama emerged as a conversation between a daughter and their mother about issues related to consent and sex and sexual harassment. And so through this sociodramatic conversation, it wasn't an actual conversation that any participant had had. It was a representation, it was a story and characters that we made up spontaneously that represented this larger social issue. And in the sociodrama, the daughter was expressing confusion about the current events and the news, about the different court cases, how men in position of power seem to be getting away with sexual harassment or even rape without accountability and punishment. And so through the sociodrama, the feelings of fear and confusion and anger and disempowerment and oppression were able to be expressed and validated through the roles. Group members offered doubling statements to each of the roles for expression. And then we got into validating the feelings, and spontaneously the role of Wonder Woman from the movie that had been recently been released at the time came into the scene to help the mother and the daughter facilitate this conversation in a way that was empowering, in a way that celebrated women and gender differences, and that promoted a sense of safety and really channeled powerful archetypal energies related to womanhood. So the sociodrama really came to a sense of closure with Wonder Woman guiding the group and offering protection and inspiration to the mother, the daughter in the scene, and to the rest of the group. So this is another example of using sociodrama to engage around issues of identity. When it comes specifically to psychodrama, there's also different ways that we can employ psychodrama rather than sociodrama to interface with issues related to identity. And I think one of the examples I could share from this from my own work is an experience I had working with a client who was in the midst of changing their gender, and their parent was really struggling with this. So this client had begun using they them pronouns, and the parent was still referring to them using she and her pronouns. The father was really struggling to accept this, and the client was struggling to feel accepted by their father and really wanted to initiate a conversation and express how important this was to them. So in our one-on-one therapy session, I initiated a short role play. We would call it a role training psychodrama, where I had the client use an empty chair to represent their father and to practice having this conversation. So they were able to have a conversation with their parent, tell them how important it was that they understood or tried to understand, or at least respected their requests about the pronouns being used, and they even were changing their name at the same time. And then they were able to reverse roles with their parent and just try to see the situation from their parent's perspective, which gave them more empathy and helped them develop more patience for their parent, who in this situation was really trying, but was struggling to understand. And then they had the opportunity through the role play to practice and try out different strategies for educating their parent, for connecting with their parent with empathy and love, and asking for what they wanted and what they needed from their parent. Now, this is another example of how we could use psychodrama specifically to interface with issues related to identity or gender. And there's lots of other examples that you can find of this. There's a recent book publication, Psychodrama in Brazil, that has various chapters devoted to using sociodrama, psychodrama around issues of identity. Leticia Nieto's work and her publications really emphasize using Pamela Hayes' addressing model for psychodrama directors in developing our own awareness of identities and how the group dynamics are impacted by identity. And there's been many others that have written and published about using psychodrama, sociodrama, sociometry to interface with issues related to identity. I would say many more examples come from our international colleagues rather than from the United States, though there seems to be much more interest and emphasis on identity and culture and race within the psychodrama community in the United States in the past 10 years or so. Even the history of psychodrama and the founders of psychodrama can be helpful to consider in this context. Jacob Moreno, the founder of psychodrama, was a Jewish, Romanian psychiatrist, and he was a refugee in Vienna, later immigrated to the United States. And there's even some suggestion through his autobiography that he was undocumented for part of his time in his first couple years in the United States. He writes about having to constantly go back to Canada to get a visa renewed and the complexities and uncertainties of that whole process. And it wasn't until he got married in the United States that he was able to get his license to practice medicine and start to be in the process of becoming a citizen. Zerka Moreno, co-founder of Psychodrama, the wife of Jacob Moreno, also was an immigrant from Europe. And I often wonder how their experiences as immigrants really impacted the development of their ideas and the practice of psychodrama and sociometry. Jacob Moreno was also a trauma survivor. Really, both of the Morenos were trauma survivors. In his autobiography, Jacob Moreno talks about experiencing childhood sexual abuse really impactful abandonment and disconnection from his father. He talks about experiencing discrimination based on his Jewish heritage. And then later he shares about the difficulties he experiences in the United States based on his immigration status. English was certainly not his first language, or even his second or his third language. And I often wonder if his experience as an immigrant and as a non native English speaker really influenced his decision to emphasize action and nonverbal communication, body language, over verbal communication in his work. Norca Moreno also experienced adversity and trauma in her life. She was a Dutch and Jewish immigrant to the United States. She met Jacob Moreno while seeking psychiatric treatment for her sister. And I can imagine that her family would have experienced much adversity because of her sister's difficulties. Zerka was 40. She had her entire arm at the shoulder amputated because of cancer and a tumor that was forming. And I got to believe that that was pretty impactful on her life. So it's hard to discredit the identities, the experiences, the culture, the backgrounds of Jacob and Zerka Moreno, and think that it wouldn't have had any impact on their thinking and on their development of psychodrama. I think their experiences of tyranny in Europe at the time probably really influenced their focus on society, their focus on democratic group structures, healing in large groups, and their emphasis of creating new paradigms for leadership within groups and within communities and within society. Jacob Moreno actually coined the term group therapy in Philadelphia at an APA conference in 1932. And the research he presented at that conference was based on his research in Sing Sing prison in New York, where he was assessing the individual identities of each individual that was living in the prison block in the community. And he was trying to restructure and rearrange the position of individuals within the prison community based on shared identities, based on complementary roles, based on shared preferences, religion, language, profession, age, and other demographic factors. And he called this group therapy, when really the way I would think of it nowadays is that it was community work rather than simply group therapy. That he was trying to restructure communities and position community members in ways where they could be therapeutic agents for each other. And through his research, he actually used many of the identities that were outlined by Pamela Hayes in the addressing model, which I discussed earlier in this video. So I thought this was an interesting connection. Jacob Moreno and his colleagues in Hudson Valley were some of the first of the social scientists to focus on racism and racial conflict within communities and within organizations. Moreno frequently promoted sociodrama and sometimes ethnodrama as methods within his society that were designed to promote healing related to intergroup conflict or larger collective issues within society and within the culture. And there are many psychodramatists that continue this method, this work, using Moreno's methods to address larger social issues. Sociodrama is sometimes a better option than psychodrama when working with collective issues, because sociodrama is more focused on the group's collective experience rather than an individual specific story. So in psychodrama, we're looking at an individual's specific story and experience and the specific roles and role relationships and people connected to them. Whereas in sociodrama, we're looking at collective roles, collective issues, and larger dynamics that are representative of shared experiences in a group or in a community. So there's lots of different ways we can use sociometry, psychodrama, sociodrama to explore these issues. And I encourage you to check out some of the examples in this book related to that. And there's multiple examples in my previous book, which is called Social Work, Sociometry, and Psychodrama. This book, you can actually download the entire thing for free if you search for it and go to the publisher's website, which is Springer Nature. In the later chapters of this book, there's a whole section on, here it is, part 6, sociometry and psychodrama in communities, organizations, and educational work. And there's multiple chapters here that focus on using sociometry, psychodrama, and sociodrama within communities and addressing issues related to identity and collective issues, collective trauma. So this 6th trauma-informed principle is one that I think the psychodrama community in the United States, at least, is sometimes lacking in. And I think it's one of the most important areas of growth for us as a psychodrama community, to really be thinking about issues of identity, to be centering them within our groups, to be using sociometry to explore identity within the group, using psychodrama to heal harms from past experiences of oppression or discrimination that individuals experience, and using sociodrama to explore collective issues related to identity within society and within organizations. So again, this 6th trauma-informed principle about identity can't be fully addressed if we're not also considering the other 5 trauma-informed principles. So I really encourage you to check out the other videos on this channel, the other chapters in this book, as they relate to the other 5 trauma-informed principles. I hope you found this video useful. And if you did, I encourage you to like the video, subscribe to our channel so you get notifications about future videos, and leave us a comment, leave us a message in the comments. Tell us exactly what you found helpful about this video, or if you think there was anything missing in this video and this discussion about identity. Tell us how you're using group work and leadership and psychodrama and other methods to help promote healing and safety and celebration related to issues of identity.